Question 1. The Fish and Kaufman classification describes. Options are A. Degree of vocal cord paralysis, B. Spectrum of laryngeal finding in LPR, C. Grading of laryngeal carcinoma, D. Stages of acute laryngitis. Answer of this question is B. It describes the spectrum of laryngeal finding in LPR. It is classification for the chronic laryngitis. Question 2. According to Fish and Kaufman, the earliest laryngeal change in reflex related laryngitis, or you can say in chronic laryngitis. Options are ringage edema, discrete granuloma, red arytenoids, and D is granular friable mucosa. Answer of this question is the C. Red arytenoids. The first stage involves redness and congestion of the arytenoid mucosa in chronic laryngitis. Fish and Kaufman grading system of laryngeal finding, which is associated with LPR and chronic laryngitis. This system describes a spectrum of laryngeal mucosal changes seen in chronic laryngitis that describe the arrangement of hierarchical changes in the larynx without a numerical grading system. So, this is a hierarchical grading system for chronic laryngitis. First grade is red arytenoid. There is arrhythmia and congestion and piled up mucosa around the arytenoid. Grade 2 is diffuse edema, include shrinkage space with mucosal thickening having minimal erythema. Grade 3 is diffuse edema with granular friable mucosa. It is more severe inflammatory changes with granulation formation. Grade 4 is discrete granuloma. There are multiple discrete granuloma or around the larynx, but they may be with edema or without edema. This grading reflects progressive mucosal injury due to reflux and irritation in chronic laryngitis. Early stages show erythema and edema, while advanced stage develop granulomatous lesions such as contact granuloma. Chronic laryngitis is a persistent inflammation of laryngeal mucosa lasting more than 3 weeks. It is often due to repeated irritation, infection, or misuse of the voice. Etiology may be infective like bacterial, Streptococcus, Staphylococcus, or Haemophilus influenzae. It may be viral influenza, rhinovirus, or fungal Candida albicans. Non-infectious causes mostly smoking, alcohol abuse, or vocal abuse. These are the common causes. Other causes may be LPR, environmental irritations, chronic sinusitis, postnasal drip, or endotracheal intubation trauma. These pathology may lead to this chronic laryngitis, and there is squamous metaplasia of respiratory epithelium and infiltration with lymphocyte and plasma cell is there in the histology and thickening of the basement membrane. Main clinical symptom is hoarseness of voice that may be coarse voice with deepening of the pitch, and there is foreign body sensation in the throat. Investigation. Flexible laryngoscopy is diagnostic. Stroboscopy to assess vocal cord vibration. Microlaryngoscopy with biopsy if malignancy is suspected. Culture and sensitivity in infective cases. pH monitoring and reflex test for LPR. DD may be early carcinoma of the larynx, vocal nodule, vocal polyps, shrinkage edema, tuberculosis, or syphilis of the larynx. Treatment of chronic laryngitis. General measures like stop smoking and alcohol, voice rest and voice therapy, hydration and humidification of the air, avoid irritants, pollution, and spicy food. B is medical treatment. Antibiotics if bacterial infection is suspected. Proton pump inhibitors for the reflex like omeprazole. Antihistaminics and nasal decongestant if postnasal drip. Mucolytics, ambroxol can be added, and topical corticosteroids if there is granuloma on the larynx. Next is the surgical treatment. Macrolaryngoscopic striping in hypertrophic lesions. You have to strip the excessive mucosa from the larynx. Excision of vocal nodules or ringage edema. Biopsy if suspicious area of malignancy is there.